Alright, post-operative female support wear, so reducing surgical site infections in our cardiac patients. So, one of the big issues in caring for our patients in the operating theatre is trying to reduce the risk of them acquiring a surgical site infection. It's now well established that female cardiac patients have a higher risk of getting a surgical site infection and wound breakdown. So to try and combat this, Harefield Hospital, for about the past 10 years, immediately after surgery, has placed a support bra on our patients in theatre. So we're trying really to be proactive about it. So, some boring facts and figures quickly. The surgical site incidence rate in NHS English hospitals in 2014-15 is 3.3%. But just to look at that a little bit more closely, for the men it's only 2.7%, whereas for the females it's nearly double at 5.8%. Now I'm sorry, I keep forgetting the number so it's on my hand. But last year there was 5,360 cabbage cases last year. And of that, 117 men and 59 women got surgical site infection. So that's quite a percentage of numbers. And the big risk factors for getting this surgical site infection is, and I've used the BIS, the Brompton and Harefield infection score, one of the big issues is actually being female, and that's demonstrated by that 5.8%. So this is just to wake you all up and get you excited, and you know, it's been a long day. But unfortunately, this is not the sort of support wear that we wear in theatres at Harefield. But what I want to bring up is there's a few issues with this. Number one, can you see the wrinkling on the side there to the right? That actually shows that it's not a well-fitted bra. So surprisingly, despite all the money that Victoria's Secret has, it's too small for her. Also, well, you've got to be objective here. Also, if this lady, if she was to lie down flat, there's actually no lateral support. So it actually wouldn't actually keep it together, which means you're putting pressure on the wound bed. So it's actually not doing its job. The last thing is, and you can't see it in this photo because I wanted to show that it was too small, is that the straps are actually quite narrow and also they can't be opened up, which means that in the theatre we wouldn't be able to put this bra on our patients. So from a more practical sort of thing, this is what I'm after. So I'm sorry it's not quite as interesting and it's not there. But the two main issues are that it opens up at the front, so it's got hook and eyes down the front, and also up the top at the shoulders, we can open it up. That means that we can put it flat onto the ITU or the recovery bed in theatres. When the patient transfers across from the operating table, we then take the pat slide out, the bra is there ready in position underneath the patient, we can do it up, and that wound bed is supported right from the beginning. So we're really looking after the patient and making sure that it doesn't place any pressure onto the wound. So, some quick facts, and this is just so you actually think about what's happening. The average bust size in the UK is now a 36D. So, there's no universal method in measuring how much the weight of breasts actually are. However, there are many studies that have used volume displacement and also imaging, and it's been estimated that a 36D, the average, is 1.3 kilos. So, that's roughly 2 pints of milk. So, just to give a good demonstration here. So, thinking about this, next time you have a female patient who is unsupported immediately post-operatively in theatre, just imagine 2 pints of milk really pulling tension on your sternal wires and your freshly closed wound. That's actually, and once you get started, the bigger busted ladies, you're talking about big weights. It can be up to like 5 kilos, which is quite a lot of tension being put on your sternal wound. A really interesting study from Canada was conducted over 2 years and showed that the patients who wore a supportive bra had significantly less post-operative breast pain and discomfort compared to the control group. The main message was that the bra stops the weight of the breast from putting pressure onto the surgical wound. So we did a QI project at Harefield, and one of the big issues that we found was that patients were wearing an ill-fitting bra, and that we also had stock availability issues. We did an audit of all our female patients, and we found that nearly 70% were wearing an ill-fitting bra, 19% were not wearing a bra at all. Oh, sorry, can I go back for 2 seconds? With the bra, it's also really important just to remember that when we pop it on, we advocate that we leave the bottom two hook and eyes undone, because patients, after they've had surgery, they generally take on a little bit of fluid, and you just want to make sure you don't put pressure on the bottom of the wound, and that is part of the most fragile part for women that can come apart, so you just want to be really careful there. Sorry. Anyway, so we only had 12% of our patients who had a well-fitted bra, which is actually quite a small thing. We're also advocating that to reduce that wound breakdown, that the female patients really need to wear a bra for 4 weeks, day and night. So the fact that we've got this many, nearly 19% not wearing one at all, is quite concerning. The other issue is that stock availability. So we had a limited range of bras in theatre, and also there's no product available for the bigger busted lady. So anybody who's bigger than a DD cup or above a 50D, we can't find anything to put on them in theatre. So our project had a fairly simple aim, and that is that 100%, so 100% of our female patients have a well-fitted bra to wear during their inpatient stay. So what we did is we looked at all the current practices in our hospital to try and work out what was happening. We did staff surveys, so we looked at people, talked to people in different wards, ITU, theatres, to try and work out what the problem is. We did an audit of patient notes, and we also looked at what our current stock was in theatres and what we'd actually used over the previous 12 months to see if there was any discrepancies. We found there were really two big issues that came out. One was that the bust size was incorrectly documented, and the other was for the bigger busted lady there was nothing available. So, as we were further investigating into what the actual issue was with the current documentation, why were we getting the wrong size, we looked at what was happening, and we wanted to find out what's the problem, what's really, it's such a simple thing, what size are you, let's put a bra on, how can we be getting it wrong? So our current practice was that patients are advised via a letter and at the pre-assessment clinic to bring in some bras to wear after their surgery, which I think is quite familiar around most hospitals. Patients were asked for their bra size on admission, so the night before when the nurses are doing the paperwork, that was asked and just written down in the clinical pathway. When the patient arrived in theatres, we then just had to hope that we had the correct size. What we really noticed was what was actually written in the notes was significantly different to the size that we actually put on them in theatre. So recent studies show that 80% of women have no idea what bra size they are, and they actually are wearing the wrong size. And we can also verify that. Everybody was saying I'm a 34B, but in reality they're actually a 38D. So it was quite a significant change in what the two figures. So the short-term implications were that we initiated a program where the nurses, so my fellow colleague Anna and myself, we went around and we actually measured all the female cardiac patients the night before. So we had an accurate measurement. We went and saw them, we just did 2 measurements, we knew what size they were. We then changed our bra stock levels in theatre, so we had a wider supply, so that way we could actually accommodate all these patients. And we educated the senior ward nurses, so that way they knew what we were doing. They knew that we were coming around to meet the patients and to actually measure them, and why we were doing it, why it was so important. We also trialled a bespoke bra, and that went through several prototypes. So, this is the BIS bra. The original BIS bra was designed as part of the Brompton and Harefield infection score, which is a tool that predicts the risk of surgical site infections in CABG patients. And there'll be more information about that tomorrow, I think, at one of the talks. So what we did is we started with the initial prototype, and then we did multiple trials, and after each trial we received feedback and made further adjustments, so that way we went through several versions. That resulted with the BIS bra, which is now available in a really large range of sizes and can be custom made with about 10 days' notice. It also has increased support to reduce lateral tension. That way when the patient is actually laying down, their breasts are still pointing upwards rather than going to the sideways. So for the bigger busted lady, we're keeping everything together, which is what we're trying to do. It's made of breathable material, so both here under the bust and under the axilla to reduce moisture buildup. And it's got improved front fastening, which also allows, if you had to do negative pressure therapy, you can actually accommodate that. So what have we achieved? We did an audit of 20 patients who were measured the evening before their surgery, and we actually got 100% of them had a well-fitted bra placed on them in theatre. Now, I think we were quite lucky with the patients that we did this on, and we had sizes available, but we actually had well-fitted bras for all our patients in that snapshot. Harefield surgical site infection rate for December and January just gone was 1.45%. We now have the BIS bra being trialled on all our female patients, and we've had really positive feedback from both patients and staff. So the patients especially are really happy, and the bigger busted ladies who always have trouble trying to find sizes say it's really comfortable and it's making life that little bit easier for them. So what is our long-term plan? What do we want to do? We wanted to continue to try and reduce our surgical site infection. we want to implement more education for the ward nurses in the pre-admission clinic. So if there's an opportunity in the pre-admission clinic, we would like them to be able to measure the patient, which they're already starting to do, which is fabulous. And if that doesn't happen due to circumstances, the night before, the ward nurses just do 2 quick measurements. So when the patient comes in, when they're doing the blood pressure, they're doing their temperature, if they can just get an accurate bust size, so that way it helps us in theatre. We want to do a long-term trial of the BIS-bra, and also we'd like to trial the BIS-bra at multiple hospitals around the UK. Just a final point. So this is just to sort of put things a little bit in perspective. So a simple intervention of implementing a well-fitted support bra is 1 minute of measuring and £30 for a bra roughly, versus a potential surgical site infection. A superficial sternal wound debridement in theatres costs approximately £5,593, which is the same as a sternal rewiring. Plus, it causes distress to the patient and greater stress on our valuable NHS resources. So, I mean, it's only a potential, but I think it's a really simple thing that we can do. I hope you've enjoyed the talk, and is there any questions?